it's kind of a tough story to go through because I recently suffered a big loss of my mother, and I've been having a lot of troubles with my you know coping.
Our clients benefit from our relationship with the mobile crisis team. They connect people to care and supports related to mental health and addiction services that are appropriate to their situation and individual readiness. They advocate for people in a variety of settings, including acute care, primary care, and social service scenarios.
Having the mobile crisis worker involved, as well as the mobile counselors before I even see a patient, they've done a lot of work in building rapport and a safe space to be cared for, with a lot of bad experiences clients have had with a very busy and often overloaded healthcare system. It's nice to have all that legwork done and to come in and see that the clients are comfortable and feeling like they're ready to reach out for help.
Mobile crisis team and CMHA work closely together, and we've kind of developed a good rapport with our clients because they know who we are now, and it's made it easy for us to approach the clients and vice versa for the clients who approach us. And it's become a good working relationship with us because then we have three minds together and we can come up with a plan and we all have something to contribute to that plan.
Sioux Lookout's known in this area as the hub of the north for a good reason. Like the population of the homeless population that the mobile unit works with, the majority of them come from 31 isolated First Nations communities. That's what's unique about our work here. And when these individuals come here for services, for various reasons, business services, they rely on the non-insured benefits to provide their travel, and sometimes if they get off track while they're here, it creates a big problem for them because now they don't know how to get home, and the mobile unit really assists them in that area, which is very important.
We have a very busy emergency department here in Sioux Lookout, and it's not always the best care for certain situations isn't always available in a timely way. So it's always nice to see clients in their own homes, meet them where they're at, and especially flag them if they've missed follow-up appointments, to try to reach out and see what their needs are and what we can do for them and support them where they're at.
We are the sponsoring organization for the Mobile Crisis Team in Sioux Lookout, operated in partnership with the Ontario Provincial Police, as well as multiple partners that are funded through the Northwestern Health Unit through a Health Canada grant that we received in partnership with Sioux Lookout First Nations Health Authority, the Northwestern Health Unit, as well as Menoyawan Health Centre, and on our Ontario Provincial Police partners. So we launched the Mobile Crisis Team in Sioux Lookout in 2021. We were funded with one position through Ontario Health North and funded through a second position through the Health Canada funding grant that I had mentioned. One of the things that we're seeing in regards to the Sioux Lookout MCERT teams, that we served over 200 individuals each year through the implementation in 2001. Is that we're seeing a lot of individuals with serious substance abuse issues, trauma-related disorders that require intervention either through frontline psychotherapy or outreach around case management with wellness checks, as well as a lot of significant mood and anxiety-related disorders that are low to moderate in symptoms that require a connection to more intensive services to support individuals to be able to connect and learn tools to manage effectively within our region. Unfortunately, in the Sioux Lookout region, what we see is a lack of extensive services to be able to provide that continuum of service within our region. If individuals require detox-related services, our closest detox facility is in Kenora, and transportation to those locations is almost non-existent. As well as outreach case management services is difficult to initiate because of either long wait lists or just the fact that it's not available within our region.
One of the best parts about the MSOR workers is they drive around in their own vehicles. They're not police vehicles. They're not wearing any uniform. It's a lot more approachable. People feel a lot more comfortable sometimes speaking to those individuals about their mental health and how they're feeling. Sometimes the uniform can be a little bit scary and people don't want to engage with us and talk to us about how they're feeling when it comes to their mental health. Sometimes people are also embarrassed to be seen speaking with a police officer or having a cruiser parked outside of their house. They want that discreet interaction with someone when they're talking about their mental health.
So we had 10 calls with the OPP related to mental health and addiction. Sioux Lookout has a high call volume, so we do attend multiple calls per day. Once we arrive on scene, we consult with the officers, analyze each unique situation, and help the individual who may be experiencing a mental health crisis. Depending on the situation, we may help de-escalate the situation. So we help individuals with symptoms of anxiety, depression, PTSD, or another mental health diagnosis, or just a situational crisis. We try and help make people feel as comfortable as possible. And then we get the client connected either with community resources or personal support. And then we also help navigate the healthcare system related to mental health and advocate for clients when needed.
When I have those tough moments, and like I call a OPP and tell them like I'm going through a really rough time. I talk with them, and I thought the OPP was just going to come by itself, but the mobile crisis team was there as well to actually comfort me and to give me a little bit of counsel. And rather than going into the police station, they brought me to the hospital so I can get diagnosed. And I told them that I was having these suicidal thoughts that were very intense. But and they stayed with me until actually the doctor came and talked to me, and they gave their input on how I was feeling. And it was very, because when I'm going through those tough times, it's really hard to get my thoughts in order. Like just to talk, because everything just feels so overwhelming. Like when you're in the hospital, and like where do you even start? Like where do I start? But they knew what I was going through at the time, because like ever since the loss of my mother, I've never had a chance to grieve, and it's pretty recent too. It happened in April, but ever since then, I just heck, even before that, things have been rocky. But when I have those moments and things like that, I know I have people to call, but and I'm really grateful for the mobile crisis team to actually be there for me, and to actually I wouldn't say speak for me, but speak about me, just to help me. And I've always tried to do better for myself, but it's always been a difficult thing. But I'm really grateful for the mobile crisis team to actually be there. Sometimes it gets uncomfortable, but I'm really grateful for them, because they I wouldn't say I'd be drowning in my emotions, but they pull me out in a way. I'm grateful for that.
This mobile crisis response program in Sioux Lookout was established in 2019 through a frontline policing grant. The program was developed to assist officers with having a mental health professional riding along with officers, or available for them to answer and respond to the mental health calls for service that police often get in Sioux Lookout. There are a high rate of addictions issues in this municipality, and over 90% of our calls for service have some connection to mental health or addictions. Having that MCERT worker, that healthcare professional with us, enabled officers to divert from hospital a lot of those individuals who didn't need to be in the hospital by creating connections to existing services or making safety plans that would get them through until the next scheduled appointment for them. The questions that needed to be asked to make sure that the safety of the individual was considered when these plans are being made are addressed so much better by a healthcare professional and an MCERT worker than the frontline police officer who've got other priorities on their mind when they're responding to calls for service. The MCERT worker is also able to stay longer with the people who are in crisis if they need a right now counseling program. They just need somebody to listen to them. The MCERT worker is able to provide that service. The MCERT program deals with approximately 200 unique individuals each year, connecting them to services or ensuring that they are getting the help and help that they need when they're encountering a crisis. So you can call 911 and deal with a mental health worker and not just a police officer to get the help that you need.